featuring Dr. Kevin Kavanagh. He started an organization that is now nationwide, Health Watch USA. He's a retired physician himself. Dr. Kavanagh, good morning.
Good morning, sir.
Tell us just a little bit about Health Watch USA.
Well, Health Watch USA is a nonprofit patient advocacy and healthcare policy organization. Currently, we're national in scope. We specialize in infectious disease, and that kind of is why we're so interested and have been so active in this COVID-19 pandemic.
Yeah, I can imagine that. Now, we had Senator Rand Paul on with us. Was that yesterday? Yeah, it was yesterday, wasn't it? These days kind of just blend together, you know.
I know it.
And you took some issue with some of the things that Senator Paul had to say. What do you say?
Well, a lot of things, and this is somewhat difficult to explain, these concepts, but the overriding concept is that masks, they are not for the person who wears it. They're to prevent the wearer, if they're an asymptomatic carrier, from spreading the virus to others. And cloth masks will not adequately protect the wearer if there's aerosolization or if other people have COVID-19 and you're up next to them. You've got to be very careful. And of course, we've talked about you need to have goggles. And ideally, you should have an N95 mask, which is a much better grade mask. But if you're one of the public, you can't get a hold of this. We do not have the availability in the United States. We need to have better federal coordination to try to get masks to the public. In Singapore, they have approximately 3 masks for everybody in their public. For us, it's hard to find a cloth mask. You have to make your own.
Right. Let me just say this, for those who didn't hear the interview with Senator Rand Paul. Basically, his COVID-19 solution was open all the schools and reserve the masks for at-risk people, right?
That's correct. And opening the schools really doesn't understand, I don't think, the infectivity of the virus. That's what makes this virus so lethal and causes so much disability. Children, even though they may, and I say may, be less infectious when they're very young, or they may not spread it quite as much when they're very young, they still can do this. And in a raging epidemic, they'll spread it quite efficiently, especially in closed, cramped quarters with poor ventilation. Children between the ages of 10 and 18, data shows they actually spread it more than adults, in any adult age category. So they will spread the virus, and we've seen this in other countries. And although they may not get sick in the short term, they can still get sick. They may get very sick, even though it is rare. But long term, we don't know how this will affect them. And they can still spread this virus to their parents, their grandparents, their great-grandparents, many of which are now their guardians because of the opioid pandemic. And we have 24% of the teachers that are at risk from getting the infection. So this really is not a good plan. And also the concentrating on death rates, to me, is really something we got to move on from because of treatment advances. Even President Trump has stated that 85% of the people now are living of COVID instead of dying of COVID. But when they're living, that does not mean recovered. And if you look at the curve, which was quite peaked early on, we did not suppress it very well. And if we had suppressed it and pushed those people contracting COVID, this period of time, we would have expected 85%, according to President Trump, would have survived instead of dying. These are lives lost. The virus does not respect geographic boundaries. We saw this early on in Kentucky when everybody was worried about the Northeast. The major outbreak, and it's still a major hotspot in Kentucky, is Warren County. If we had better messaging and better action from our leadership, I feel that those individuals could have been pushed out to this time of day and had better treatment, and possibly lives would have been saved. So this is a very dangerous virus. New Zealand had an outbreak. They're closing down a whole city because of it. And that's an outbreak of 17 people. Other countries are taking this virus very seriously. We, however, are still not doing that.
All right, we got 253-5959. That is our phone line. It is also our auto text service text line if you'd like to send us a text. Caller is coming in right now. We've got a few texts. Let's go with my son will be starting college, and I want the best mask. I've seen some cloth masks on Amazon with filters and circular style filters, but read they aren't effective. What do you think?
Definitely don't use those because those filters do not protect other people. They're not recommended for use in this pandemic. You want to get an N95 mask if possible, and also goggles. I know goggles may be something that's not very chic to wear. It's not really, in vogue, but goodness, you can get spread through the eyes. And if you want to be 100% safe to protect the wearer, you need added protection than just the mask. Remember, the mask is for the community, trying to drive down the R0 so you can stop and slow down this pandemic. It doesn't necessarily give you good protection.
You said you can't get the N95, so what's plan B?
Plan B is a good cloth mask with multiple layers. You've got a number of patterns that you can get these from if you have to make them yourself. I believe the CDC has patterns on their website, so does Johns Hopkins.
Okay. Jim says, look at the data from countries that have reopened schools in Italy, Germany, Norway in April and May, and have seen no uptick in the coronavirus 19.
Well, first of all of those countries reopened the schools at a nadir when they weren't in the midst of a raging epidemic. And that is the main problem. And not all the countries haven't seen an uptick. Israel certainly has. They had to close, I believe, 130 schools and had a major outbreak. Korea had to close schools. Northern France had to close schools. Germany had to close a school district. And this was when the virus wasn't spreading. So no, that's misinformation that's floating around. The areas and countries that have opened up schools have had problems. And we've also had problems in Georgia. I mean, we couldn't follow the advice and the experience of other countries, and it looks like we can't follow it now the United States either. Other countries have had problems. And remember, they opened at the nadir when there wasn't raging community spread. These are our children. We need to protect them. We need to have them safe. They should be our paramount concern, making our community safe so we can open schools safely and they can get back to school.
Read a story online this morning that said the flu, get ready for the possibility of a really bad flu, and that they're storing up the vaccine for that. And the problem is going to be that people are going to get confused as to whether or not they have symptoms of the flu or the COVID, and it's going to wreak havoc on our testing facilities.
Well, I do think that is a concern. I certainly would get your flu vaccine. But one of the things that you need to realize is that the same steps we're taking to prevent COVID will also prevent the flu. In other words, wearing masks, social distancing. And the flu is not nearly as infectious. It has an R0 of about 1.3. COVID is 5.7. If you look at the southern hemisphere, steps taken have obliterated the flu. They don't have much flu down there. It's all COVID. So the steps you take may not be effective enough to snuff out the COVID epidemic, but it may well snuff out the flu epidemic this year. So I'm not sure if that's going to take place, but it is a concern because if you do get hit with the flu plus COVID, you're in deep trouble. There's no doubt about that.
And this is Ken. Good morning, Ken.
Good morning. Hey, Dr. K. This is Ken. And the question I have for you is about the COVID.
Yes, sir.
And the recovery rates. I just recovered from it. Okay. And we acquired it, and I had a bad case of it. The only thing I felt like saved me, and I had about 4 days of 102 temperature, I ended up with pneumonia. My doctor finally prescribed me a nebulizer with Budzidine. I think it's Benzidine, Budesonide, and a Z-Pack. That's the only thing that turned this thing around. But if anybody has this thing, my recommendations is to get a oxygen meter. At one point, my oxygen levels dropped to 86 and 88. That's common, correct?
Yes, that's common. In fact, people who are asymptomatic, there are studies being done that shows that they're still getting lung damage. And we still don't know the long-term effects of this. And this is why I said it's very important we start to get away from the idea of either you die or you're well. There are long haulers that are getting months and months of symptoms from this. If you get into the hospital, about 20% of those individuals are being reported to have heart damage. About a third may have kidney damage or kidney dysfunction. If you're in the ICU, the numbers get even worse. 20 to 30% of those in the ICU can get thromboembolisms, and 90% of those requiring ventilation are also on dialysis. So this virus, unlike the flu, affects every organ of the body, and it may persist for some time. We see this in herpes. It can come back whenever. It really doesn't go away. And we're still learning about the virus. Now, the good news is that in the majority of the people, it appears they do recover. But it can take much longer than the flu, and we're still learning about this virus. Now, I've got more information about this, along with schools, on healthwatchusa.org under continuing education section, where we've got some videos and slideshows with abundant references to a lot of the points that I'm making during this program.
Hey, Ken, I think we've been talking about this obviously since its beginning. I may be wrong, but in my memory, I think you're the first person that's called that's actually had it. So I appreciate that you called.
Thank you. I've been listening, and I'm stepping forward with it, and I do still have a problem with my breathing. And this is I was cleared this last Monday that I'm not positive with the virus. I feel like my cognitive skills are lacking a little bit. I'm self-employed. I run a business, and I feel like that is something that we're not addressing either, or not as much.
You mean the
cognitive?
The cognitive we're not addressing? Yes. Yeah. What do you say to that, Kevin?
Well, that's a huge problem. That's one of the major symptoms, if not the major symptom, of these long haulers and of the people that are recovering. And that's why I said we need to get away from this, he survived because he got remdesivir and everything's fine. No, that's not the case. These people continue to fight, in many cases when they're very sick, for many, many months. And we only have had this virus for a few months. So we're really not sure what's going to happen long term. And if you are in the hospital, these type of symptoms, what you're seeing, are even worse. It's very frustrating.
How old are you, Ken, if I may ask?
If I make it to December, I'll be 60.
Okay.
And in good health, I take nothing. I'm in really good health.
Okay.
My resting heart rate is 59 to 62.
Well, that's probably why it wasn't worse, and maybe even didn't take your life, because you are in good shape. Well, listen, we wish you. Go ahead.
Okay, I was going to say, no, I had about a 2-week experience that I don't want to repeat.
I bet you don't.
So no, I don't wish it on anybody.
Luck to you, Ken. I appreciate your call. Thank you very much. Dr. Kavanagh, 30 seconds, real quick.
Well, I think that it is very important to realize that this pandemic is very infectious, and that's where the lethality and the disability is coming from. And that when you're in the middle of a raging pandemic, it's not a wise time to open up schools, because even if children are proven to be somewhat less infectious, that's not going to make up for the viral spread during a raging pandemic.
Thank you. We'll talk to you on Monday.